you had a meniscus injury, then you should not get an operation straight away. But if you're going to do rehab, then what should you be doing? In this video, I'm going to walk you through the rehab step by step. Phase 1 is all about restoring range of motion, full gait pattern, and initiating some foundation level strength exercises. If you have an acute injury and you have a swollen knee, then icing and compression can help. A game ready machine is amazing for this, but compression bandages and a good old bag of frozen peas can work as well. Getting your walking back to a good level is the next thing you need to do. From a rehab point of view, static quads with or without a complex machine can be useful in order to stimulate the quads and ensure full range of extension, range of motion, which is really important in knee rehabilitation. Passive quad stretches are next to look at the knee flexion range of motion, although this one might be painful in the latter ranges, so just go slow and don't force this movement. It will come in time. Once you're walking with relatively little pain and have a reasonable bend of the knee, so let's say about 100 degrees for the average person, and start phase 2, which is where the fun begins. We want to think of meniscus rehab by thinking about the muscle groups that help support the knee and its function. So the big 4 of these are the calves, the hamstrings, the quads, and the glutes. So in phase 2, we're going to do one strength movement for each muscle group, plus we're going to continue with the gentle flexion stretches that we did in phase 1. Calf raises are used for the calf. Try single leg and weighted variations to progress, and aim for 2 to 3 sets of 12 to 15 reps. Bridging variations are used for the hamstrings, so double leg bridges, single leg bridges, weighted and sliding variations are all fantastic choices here. And again, aim for 2 to 3 sets of 10 to 12 reps for this one. For the quads, we're going to do some sit to stand variations, so thinking about squatting and squatting to a chair. I like single leg variations for this one, which will also work the proprioception of the knee, and adding weight eventually and aiming for 2 to 3 sets of 10 repetitions. For the glutes, my favourite variation is a side plank variation, so starting with side planks with leg lifts, and you can extend the leg out for a harder variation as you progress and add load to this. 2 to 3 sets of 12 to 15 reps is good for this one. Boom. Do phase 2 for enough time that the knee now starts to feel no pain walking, and even a little jog or trot is not painful. This might take 3 to 4 weeks for some people, it might take a few months for others. Again, don't rush the rehab. We are setting your knee up for success now, so you don't have to have an operation and risk future OA, so it's worth doing. Phase 3 might be needed for some people, but for some it might just be fine at phase 2, and that's all you need to do. This is the phase for sporting individuals or people getting back to a really high level. We're going to keep the exercises for phase 2 in this phase, but drop the reps down to 6 to 8 reps and ramp up the weight or resistance, and that's going to help us develop our strength. What we'll also add in is some plyometric drills and change of direction drills here. So we're going to work on 50 to 100 contact times, so how many hops essentially you would do or contacts with the floor. And we're going to think about quality over quantity, so nice and light on your feet, nice and springy using those pliers to really help develop that speed. Hopping, change of direction and turning are all key aspects to focus on here. And we want to think about the demands of the sports that are involved. Forces that are involved when you're doing sports, the physical and mental fortitude to cope with and thrive with your newfound strength. If you want to delve into why doing this rehab is so important and why you should not jump into surgery straight away when you have a meniscal injury, then watch this video of me reacting to a crazy study that proves exactly why this is the case.